Hello there. Brexit has exacerbated the shortage of doctors in the UK. According to a study published on Sunday, an estimated 4,000 doctors from EU countries are missing in the most important specialties. Even before Brexit, Great Britain was dependent on health workers from European countries. The exit from the EU makes it more difficult for doctors and nurses to work in the country. And according to a study, the resulting gap is even larger than expected. According to this recent study, Brexit has exacerbated the acute shortage of doctors in Great Britain more than expected. According to the study by the Nuffield Trust think tank, more than 4,000 European doctors are currently not working in the British healthcare system, and that's fewer than was forecast before Brexit. And the Guardian newspaper commissioned this study. The increase in the number of staff from the EU and the European Free Trade Association, the EFTA countries, has slowed down and had fallen below the forecast increase, the report said. EFTA countries include Norway, Switzerland, Iceland, and Liechtenstein. Greater impact on nurses was there last year because around 37,000 doctors from European countries worked in the UK, and without Brexit, it would have been almost 41,300, they say. The departments of anesthesia, pediatric medicine, cardiac surgery, and psychiatry are particularly affected. Brexit has a much stronger impact on nursing staff who come to Britain from other European countries. There are currently 29,000 nurses. Without Brexit, however, it would have been 87,000 according to the forecasts. In the 2021-22 financial year, only about a 14th of the EU workers came into the country that have been there 2015 or 16. However, the number of professionals from other countries such as India and the Philippines increased significantly. The researchers see the obvious reason for the U-turn in 2015 and 2016 in the outcome of the Brexit referendum. Because of Great Britain's exit from the EU, skilled workers now need work visas, which are associated with high costs and a great deal of bureaucracy. The deteriorating working conditions in the health system also contributed to the decline. The UK's NHS health service is chronically underfunded and understaffed. In England alone, there is a shortage of more than 10,000 doctors. The British healthcare system was therefore already dependent on staff from the EU before Brexit. The British Ministry of Health, however, rejected the results of the investigation. This analysis is inaccurate and we do not recognize or agree with its main conclusions. That's how The Guardian quoted a spokesman for the ministry as saying. On the other hand, significant progress would be being made in the training and recruitment of medical staff, they say. Accordingly, there should currently be even more staff than in 2016. Well, if they say so. The Nuffield Trust, an independent healthcare think tank, focused on 4 areas of medicine. That's anesthesia, pediatrics, cardiothoracic surgery, and psychiatry. That prior to the UK's exit from the European Union particularly looked at European doctors because they were very dependent on them, on those areas. The think tank noted that in the 4 areas where recruitment was already difficult, the increase in EU and EFTA staff has slowed and fallen below forecast increases. If the trend observed before Brexit had continued, more than 40,000 doctors from the EU or EFTA would have had to register in 2021, and that's at least 4,000 more than the numbers they have now. The campaign and the outcome of the EU referendum are the obvious reason for the U-turn in 16 and 15, says the study. And I have said that before in the video, but this is an important point because the voting already started it, not the real Brexit. They highlighted initial uncertainty about new rules governing the free movement of people, followed by tighter visa requirements and deteriorating working conditions, as I said. And the results suggest that stagnation in the number of EU doctors in these specialties has exacerbated existing shortages in areas where the NHS has been unable to find sufficient qualified staff elsewhere. And the Royal College of Nursing announced last week that its members will go on strike next month for the first time in the union's 106-year history in England and Wales. So Brexit is a gift that keeps on giving. I'll see you in my next video. I'll be back.